Hi, I'm Justin. I'm a clinician here at Grand Rapids Counseling Services, and today I want to talk about having a family member with schizophrenia. And I want to start out with being honest that schizophrenia is just a difficult disorder, and it's as difficult and frustrating for the person with schizophrenia, and it can also be as frustrating and difficult for the people who support and care for someone with schizophrenia. Now, we have effective treatments for schizophrenia. We know that the most important aspect of treatment for someone with this disorder is effective medication, and that includes medication adherence. Second to that, what helps people the second most for someone with schizophrenia is that they have enough social support. And we know that in urban areas, social support is not as effective as it is in rural areas. And there's some reasons for that, but we're not going to stay there. And then third, most effective management strategy for schizophrenia involves counseling and therapy. And there's a lot of psychoeducation that can come in, talk about what this disorder is and how it's experienced, and then giving the people who support the person with schizophrenia as much information and knowledge and understanding as is possible, so they know what to do when their loved one gets in trouble. So I want to talk about what happens and how to help someone whose schizophrenia has decompensated, meaning it's gotten worse. There is something called Kevin's Law, which is a newer law on the books that allows a person with schizophrenia to be hospitalized if they are at a great threat to decompensate, and can expect it that they will require hospitalization at some point if there is no intervention. So what it does is it reduces the amount of suffering someone has to go through before they can get into the hospital. That's a wonderful thing. So if you see that the person that you care for with schizophrenia is not doing well, bring them to the emergency department at your local hospital. Social workers there know what to do, and they may ask you to petition your loved one, which means it's a probate court form where you just write down why you think they should be hospitalized, and they can walk you through it, and they'll do a clinical certificate on their end if they see that this person absolutely needs to be at a higher level of care than what they were at before. It is not a difficult process, but just if I give you a tip, have talking points about how you know that what you're seeing now does mean that this person is not safe, and they're not going to be safe until there is a kind of intervention that can happen at a hospital. So keep up the good fight. It's really hard work. There's support out there. If you have a loved one with schizophrenia and you want to sit down and talk about what that means for you and how to keep them safe and well, I'd be more than happy to help. We're just here at the corner of Alger and Eastern in Grand Rapids. My phone number is 616-419-8149. All right, take care.